We're here today with Dr. Tunde Okewale, fertility expert and the author of How to Get Pregnant and Have a Baby. So today, we've had so many people ask about unexplained infertility. So today, we would be discussing everything you need to know about unexplained infertility. It's going to explain, and then you guys can call in. I can already see some people trying to call, but it's going to have to explain first, and then I will take your calls. All right, so I'll make sure I take the first calls first. So give me some minutes, okay? All right, so today we're going to be talking about unexplained infertility, and the expert here is going to be giving us insight about unexplained infertility. Thank you so much again for today.
Thank you.
All right, so today, like you already know, we're talking about unexplained infertility. Can you please explain to us what is unexplained infertility?
Okay, thank you so much. Now, I think I should start by explaining what infertility is.
Okay.
Infertility is defined as the inability to achieve a pregnancy after you've gone through an unprotected regular intercourse for 1 year. Irrespective of what has happened, if you approach a doctor and you say, I'm trying to get pregnant, and he asks you those two questions, have you gone through unprotected regular intercourse for 1 year, and you say yes, then he will say you're suffering from infertility. Now, after that, usually what the doctor does is he tries to do some investigations to try and find out why you're not getting pregnant. Now, the way to get pregnant, to achieve a pregnancy, if you see anybody who has gotten pregnant, any couple who has gotten pregnant naturally, these are the things that happen.
Okay.
There are 5 requirements. The first, like we said earlier, is the sperm of your partner must be of good quantity
And good quality.
That's the first requirement.
Okay.
The second requirement is you yourself, you must be seeing your period so that you would know your fertile period, you would know your ovulation period, because it's only at that time, if both of you make love, that pregnancy can occur. The third is the inside of your womb must be able to accept and be able to keep the pregnancy. There shouldn't be anything inside the womb that will disrupt pregnancy. Whether it's a fibroid, whether it's a polyp, whether it's an addition, or whatever it is, or it's an infection, there must be nothing in there that would affect pregnancy.
Okay.
The fourth thing is your tubes, the fallopian tubes, must be open so that the eggs that you form from the ovary can enter the tube and meet with the sperm.
Awesome.
And then finally, you should be producing quality eggs every month. If you see any woman or any couple who had gotten pregnant naturally, what it means is those 5 things worked for them. In the same way, if anybody comes to a doctor and says we've been trying to get pregnant for some years, the essence of all investigations is to check those 5 things. And then, so the investigation is checking those 5 things we said. So he would want to check your husband's semen to be sure it's okay. He will want to know that your period is regular so that he can tell you when you are safe and when you are not safe, when you are fertile, etc. He will want to check the inside of your womb. And there are quite a few tests you use to do that. You can do an ultrasound scan, you can do an HSG, you can do what we call a sonohysterogram. He will want to check your tubes to be sure they are okay, they are open. And HSG can tell us that, a laparoscopy can tell us that, and he will want to be sure that you are producing quality eggs every month by doing a hormonal assay. Now, if you've gone through all those 5 steps and everything comes back normal, then we say you have what we call unexplained infertility. That means all the basic investigation has been done and nothing was found. Now, the problem with unexplained infertility is this. In a normal couple, it takes them, their chances of getting pregnant in a month is like 25% in 1 month.
Okay.
Whereas with unexplained infertility couple, the chances of getting pregnant in 1 month is like 1 to 4%.
Wow.
So you can see the difference, despite the fact that you couldn't find anything wrong with unexplained infertility. So once you've gone through all those investigations and nothing was found, then we'll say you have what we call unexplained infertility. That's right.
Wow, thank you. That's quite detailed.
So
how
once
do
you've
you
gone
know
through
you
all
are?
the infertility tests, all the known infertility tests, and nothing was found wrong, then we label you as having unexplained infertility.
Wow, okay. So, you know there's nothing wrong with you. They've checked you, they've checked your husband, and they've gone through all the processes, and now you're still not getting pregnant. I can imagine that can be so frustrating. So, is there any treatment for unexplained infertility?
Right. So the treatment for unexplained infertility will depend on the age of the woman. Okay. If this happens in the early stages of one's marriage, let's say one was in the early 20s, you could have what we call expectant management, or so-called wait and see. In such couple, for normal couple, if they wait for 3 years, if you give them an expectant wait and see treatment, if they wait for 3 years in normal couple, in nearly 100%, they would have gotten pregnant. Normal couple, that there's nothing wrong with. But in unexplained infertility, 40% of them would have gotten pregnant within 3 years, which is really low. Bearing in mind that for most people, before you label them infertile, they would have tried for 1 year. And for most couples that there's nothing wrong with them, 90% would have gotten pregnant within the year. So in unexplained infertility, 40% will get pregnant if they just wait doing nothing for 3 years. That's a treatment option, especially if the couple is still young and they're not under any pressure. You know, our society is a bit different.
Sure.
The second thing you can do is to use ovulation drug for the couple. The reason for the ovulation drug is it will increase the quality and the quantity of the egg, so that each month there are more eggs presented to the sperm, so that pregnancy can occur. That's a second option in terms of treatment. The third option is to do what we call an assisted conception technique called IUI, intrauterine insemination. The reason for that is when you've tested everything and you still don't know what has happened, then you start wondering, why is the sperm and the egg not meeting? So sometimes you start suspecting the cervix. Is there anything in the cervix or in the cervical mucus that is debarring the sperm from going in? Are there antibody problems? Does the cervical mucus repel the sperm? So you find a way to bypass the cervix. And intrauterine insemination is one of the ways you can bypass the cervix. In such situation, you prepare the husband's sperm, you put it in a small syringe, and you inseminate it directly inside the womb during the fertile period of the woman, after you've already stimulated the ovary. That is IUI. As a last resort, in unexplained infertility, we opt for IVF, in vitro fertilization. And it can be very successful in unexplained infertility. The figures are much higher. If in about 50% of people who have unexplained infertility, they can conceive at the very first cycle of an IVF. So those are the 4 treatment options: expectant, or you use an ovulation drug, or you do an IUI, or you do an IVF.
What's the success rate of the IUI?
The IUI can be quite successful too. In about 50% of cases, the cumulative success rate in IUI in unexplained infertility could be as high as 50 to 60% as well.
Which is quite high, right?
Which is quite high, yeah.
Wow, thank you so much. All right, so before we go on, I would just want to like I think I should pick
go
some
ahead.
calls.
That's right, yeah.
All right, so let me see if they're still there. Oh, all right. So if you're trying to call in, you can call in now. I think I missed some of them already. I'm trying to look for the person that was trying to call in. So, all right. So I'm just going to read out some questions that we have here. I'm sorry for the... All right, my question was not attended to yesterday. All right, please send in your question. Yesterday is gone. I do not know all the questions, so... all right, I think I'll just go on with my...
Okay, I think there's a call.
Where? Okay, yes. All right, so let's pick this call. So, contact over there.